Well, fortunately, the clinical approach to paranormal, the spiritual or psi experiences is growing in many countries, mainly in Europe and Latin America. This branch of parapsychology is having more recognition than psi research itself, and probably in the future, many clinical psychologists and other therapists and counselors will have interest in psi research thanks to its clinical study. However, we should also recognize that since the founding of the Society for Psychical Research in 1882, several authors have pointed out possible connections between paranormal experience, altered the state of consciousness, and dissociative states, as they play a role of hypnosis and the dissociative identity disorders, paranoia, dissociation, somnambulism, and amnesia. Psychiatrists and psychoanalysts like Servadio, Ehrenwald, Hullman, Devereux, and Eisenbud, among others, who stuck with the topic, discussed the role of psychic transference and counter-transference, the concept of unconsciousness influence, communication psi as they arise during psychoanalysis, and the significance of psi for the understanding of psychosis. Ethical concerns into the clinical domain and introspective exploration of fears psi will be the topics dealt in this presidential address in order to analyze the contribution of clinical parapsychology to psi research. The therapeutic approach to the investigation of paranormal, anomalous experiences has been a topic of the great interest for many clinical psychologists. For example, the dynamic approach, the understanding such experience can be seen in the use of the term transference in consideration of the parent-child relationship and extrasensory, and in interpreting telepathy dreams from which psychodynamic model have been developed. Other studies have included clinical and theoretical approach, and there has been some consideration of the performance of psychics as advisors or therapists. The terms clinical parapsychology was used in mid-70s by Montek Ullman. Transpersonal psychology added a new perspective by understanding exceptional or spiritual experiences as things of spiritual growth. Parapsychology Foundation Conference on Spontaneous Psi, Depth Psychology, and Parapsychology was held in Berkeley, California. In London, a conference about clinical practice was organized by the Parapsychological Foundation also, allowing experimentally working parapsychologists, clinical psychologists, psychotherapists, and psychiatrists to meet and discuss aspects of clinical approach of psi. In 1995, at the meeting of the Parapsychological Association, a panel discussion on clinical parapsychology was organized to exchange thoughts and ideas about counseling strategies in the context of anomalous and paranormal experiences. Counseling approach carried out by Kramer, Bells, and Fatch, Bauer, and me, focus on the need for the experience to be normalized and encouraged, but if necessary also diagnostic as a psychopathological process. In Arden, Netherlands, Freiburg, and Paris, a clinical parapsychological experts meeting was organized and chaired by Kramer with participants from different countries who discussed the state of art in clinical parapsychology. Most recently, Christine Simmons-Moore also recognized that exceptional human experience can and do have value for physical and mental health, and collect a number of essays in a book which explored the nature of mind, its impact on the body, and the relationship between exceptional experiences and physical health, mental health, and the potential for other types of perception by normalizing experience that are often pathologized. This year, Fatch, for example, conducts a comparative empirical study of several characteristics of exceptional experiences for two samples, one from the ordinary population and the other from clients seeking advice, and they found similar phenomenological patterns of exceptional experiences in both samples, which support the hypothesis of a continuum spectrum between mental health and mental disorder for the type of experiences analyzed. Renaud Ebrard also reviewed the literature on exceptional experiences in the academic literature, and he found that emerged a clinical practice with people living experiences, exceptional experiences, which rely on some differential clinical elements, possibly relevant for the other clinical practice. Parapsychologists are often approached by lay people seeking validation for their beliefs or experiences. Psychodynamic influence on psi require empirical clarification. Dealing with subjects sometimes reveals peoples in need of psychological intervention. Similarly, psychological problems require intervention. Sometimes parapsychologists are approached specifically for counseling service because the ostensible psych cases, parapsychologists are obligated to attend the problems of services because their specialist knowledge, including research findings, clarified psychology relations, puts them in a position to improve the standard of care in certain cases. The ethical obligation to develop new and effective treatment forms conflict with the need to prohibit procedures based on questionable grounds. Parapsychology is in a difficult position here because of the controversial nature of its subject matter and because some factors that may predispose psi are informed by different cultures whose ethical foundations conflict with one another. These and other problems must be examined in order to guarantee professional and ethical service to clients in need. Ethics consists of a discipline that, like science, search for general principles from which one may deduce the right things to do. Thus, ethics traditionally has been patterned on a view of science which has been called the hypothetico-deductive model, in which one deduces from a general principle, or law, how an object must behave. No, rather than concerning ourselves with principles, one thinks of morality as being concerned with exemplifying virtues such as being compassionate and understanding. Just as this understanding of science has been questioned, so our view of ethics is changing. An ethic based on civil interaction accepts the contract model of ethics as paradigmatic, but the fact that our culture is entering into marriage contract is a reductio ad absurdum of this view. Rather than taking the abstract contractual point of view as encompassing morality, ethical thinking is reinforcing the intimacy of personal relationships as more paradigmatic. Several implications for parapsychology. First, in relation to subject, we should not think of our moral obligation to our subject in some sort of contractual or legalistic way for two reasons. The legal is mainly prohibitive and say more about what we may not do than what we ought to do, and contract and legal obligation are on the civil end of the spectrum, not on the intimate. Parapsychology is a not clinical science. Rather, it may be related to clinical application in psychiatry, psychology, psychoanalysis, or pastoral counseling in a manner analogous to the relation of the biochemistry to clinical application in the practice of medicine. Some patients present complaints ostensibly related to psi phenomena. Others present apparent psi phenomena in the course of the psychotherapeutic treatment. Like all clinical phenomena, psi events occur during psychotherapy must be subsumed into the general purpose of treatment and cannot, in that context, be used to explore evidence for psi. In clinical situations, it is necessary to attempt discrimination between psi and pseudo or delusional psychic experiences. Furthermore, either type of experience seems to move forward either integration or disintegration of the patient's overall psychological health. The Parapsychological Association might consider to move toward clinical applications of psi research. The potential clinical application of parapsychology clearly raises the problems of ethics, malpractice, and legal vulnerability if such intervention is judged by the prevailing standards of ethical clinical conduct. For example, a patient alleged psychic experiences may be treated as such by a clinician, but should the patients subsequently develop clear signs of paranoid schizophrenia, the clinical may be held accountable for neglecting the delusional nature of the psi material therapy and intentionally contributing to the enlargement of the patient's psychotic system. The Parapsychological Association might also provide guidelines to clinicians as to observations that might help to distinguish reported parapsychological events from experiences that are more evidential of psychological disorder. There should be no legal or ethical problem with such guidelines. The existence of such guidelines would be a protection to clinicians concerned with psi occurrences in psychotherapeutic practice. Those parapsychologists who are also licensed practitioners in the mental health field code under the auspices of the Parapsychological Association form a committee or a branch of the association for the specialized purpose of acting as a referral source outside the field of mental health. Patients in whom psi experiences are a significant problem could be referred for consultation to such a committee, or it's designated in a manner analogous to referral for psychological testing, X-ray, sleep evaluation, or other traditional medical support systems. A practitioner referring a patient for such a specialist evaluation would have a more easily defensible ethical stance than if an attempt were made to bring parapsychological evaluation within the ordinary range of practice of an established mental health profession. All of these ideas raise various questions. Is clinical parapsychologist a distinct subspecialty like organizational, social, or counselor psychology? Is it rather an integral component of standard psychological training like minority issues, child abuse, substance abuse, and human sexuality? Assuming a distinct base of knowledge, what do clinical parapsychologists do that differs differently from the standard practice of clinical psychology? For example, given a patient increases, regardless of the subject matter, are there techniques for handling this that are specific to clinical parapsychology? What are the legal and liability issues that surround those practitioners? Are they at greater risk in the courtroom because of the non-traditional nature of the file? What are some possible issues regarding obtaining malpractice coverage and billing insurance companies? Given that fear or psi is a major topic of concern among experimental parapsychologists in terms of both the population from which subject pools are drawn and its consideration of experimental effects, it seems appropriate to combine introspective study on the part of the experimenter with investigation of methods to reduce fear in participants. The sensitizations and increased attention to ethical behavior and consideration are two types of response for individual action to counter such fears. Preliminary conclusions are the existence of fears that fall into four of the categories described by Charles Tart. Fear of developing a different worldview that would lead others to distrust one's sanity, fear of losing abilities to distinguish what is real, fear of psychic abilities of others making the world more complex and potentially more sinister, and fear of the abuse of psychic powers through individual shortcomings. The fears are of the potential harm that may come from experiences or seeing something paranormal, or from expecting that the phenomena will increase in severity and frequency. As parapsychologists, one of the things we run into when speaking with those outside our field is the fear reaction that strikes people have psychic experiences or who are exposed to psi phenomena. These misconceptions are spawned and support both by inaccurate media representation of parapsychology and by fantasy image that often present psi in a destructive context, sometimes under the claim of being based on a true history. Also, books like those by Stephen King do have some impact on their readers' perception of psi. Books, unlike films, are generally clearly labeled as fictions, fantasy, novel, or horror, and notable exceptions being Sixth Sense, the movie, for example. The discussion centers of those portrayals that affects the public's assumption of what psi is like. It covers also the questions: 1. Why some people are apt to accept the special effects version of psi more than one's closer to reality? And the second one, why filmmakers tend to accept and promote this image? The fears that people under such extra pressure can describe may also suggest the unconscious fears of others. Preliminary research suggests that many people, including some parapsychologists, may have pre- or pre-unconsciousness fears of psi. What fears might people who are very heavily involved with ostensible psi in their daily lives psychic have? The categories with ostensible psi in their daily life psychic have. The categories of fear expressed were: 1. The unknown quality of what one is opened to by psi, the uselessness of unconventional views of the reality as a guide. Second, loss of control, the feelings that one may be used by what one's contact. Third, giving power to others to validate or invalidate one, inherent giving a psychic reading for a client or acquaintance. 4. Confusion resulting from malicious invalidation, an event that can happen when a client being psychically read is enabled to accept the reading. 5. Distortion of self and of psychic functioning resulting from the need to please. 6. Forced change in oneself resulting from the new insight about and perspectives of oneself that psychic functioning can bring. 7. Succumbing by others' emotions, losing track of one's true self. 8. Lack of criteria for validation of unusual experiences, since one is functioning beyond the ordinary social knowledge. 9. Maladaptive loss of ordinary fears caused by experiences oneness with the universe. Then, fear of success. 11. Isolation resulting from an inability to communicate, the ineffability of some paranormal and anomalous experiences, coupled with the feeling that they are so important one wants to communicate them. 12. Invalidation of no conventional work ethic value if one feels that psychic force will make things work out. 13. Frightening others who are afraid of psychic abilities. 14. Getting ill from taking some others' problems. And 15. Problems in handling new sort of power. Well. After research on experimental bias has shown such hidden emotional factors may seriously distort scientific research, fear of psi can also be understood best when viewed against the background of modern neuroscience and familiar psychodynamic principles. Two categories of psi had been considered: need-determined, spontaneous incidents, and flow-determined, domesticate incidents of the statistical card calling, for example, or dice throwing type or other experiments. For Ennenwald, fear of psi is engendered by the trinity breakdown of one or another layer of our structural or dynamics defenses. The strength of the filter can be gauged in terms of ego strength or the blocking power of the left hemisphere. The ensuing interhemispheric tug of war may be particularly menacing to precariously balanced left hemispheric egos, for example, of contemporary Western scientists. In some, fear of psi is largely due to a threatened disorganization of the ego. Dopside research sabotaged their own efforts to carry out successful experiments and establish mainstream credibility for their works. It is essential for psi researchers to understand and resolve these sources of internal conflict before we can make significant social and scientific progress. Many psi researchers have ambivalence toward achieving success in this field. This is a matter of conscience tempered by ambition. Psi may become a force for peace by putting us in closer touch with one another and our world. The fear of criticism also leads many researchers to describe their findings in strictly traditional academic terms, primarily as a statistical variation from the so-called chance expectation. It is not enough for us to describe our findings in such strictly statistical terms, however, without also offering some potential explanation of the meaning and importance of the statistical deviation we have achieved. One way of overcoming such dogmatism is by viewing, describing, and presenting ourselves not as parapsychologists, but as psychologists, physicists, and other scientists conducting psych research working in our chosen fields. Parapsychologists also complain that their work is not widely accepted, a situation that is certainly changing. They have also adopted familiar, if not completely comfortable, roles in response to this situation. Another is by encouraging open-minded members of the mainstream scientific community to conduct their own exploration of the nature of psi and invite them into our laboratories, not as adversaries, but as associates. Why is it the even parapsychologists still have much resistance to psi? One reason, which seems plausible to me, is that ultimately we fear the larger-scale implication of our research. Thus, it is our fear of accepting the responsibility of being psychic which creates resistance to even among parapsychologists. One of the most implications seems to be the suggestion that psi is an inherent ability in us all. As a result, it seems natural that we would be resistant to such a thinking. As a result, it seems natural that we would be resistant to such a finding. After all, would not our research be much easier if only selected few were psychics? It is my contention that this implication that we are all psychic is one of the most ignored things in our field. Quitter, an author, parapsychologist, member of the PA, suggested that the possibility that parapsychologists cannot psychologically cope with the thought of being psychic seems to be the dramatic change in our perception and experience of reality which would inevitably occur after accepting such a concept. Can we accurately imagine what our experience of physical reality would be if we had unlimited use of psi? My basic point is that resistance to psi among the parapsychologists is due to our inability to cope with one of the most important implications to our research, that everyone possesses psi, and the reason of our inability to cope is due to the tremendous weight of responsibility its acceptance seems to place upon all of our shoulders. Parapsychologists have marked resistance to following out the full implication of their data, particularly those relating to physical phenomena. Eisenberg wrote that, literal, resistance can take many forms, of which the most insidious is probably excessive scientism and difficulty in separating the wheat from the chaff in the methods and goals of science as they relate to the investigation of the paranormal, along with this ghost and ability to appreciate the extent of inherent opposition between the canons of scientific procedures and the scientific study of the paranormal. Significantly, parapsychologists exhibit a high degree of resistance to concepts and methods of depth psychology, particularly those of psychoanalysis, for example. It is not beyond belief that the scientific study of parapsychology, as opposed to the total immersion in the occult that characteristics certain groups disdain by the academic core in the field, is, however, rationalized, basically counterphobic, that is dictated by a need to keep psi safely at arm's length by always having it within one's sight while unconsciously doing everything possible to inhibit its major manifestation and its impact. As parapsychologists and mental health professionals, it is important for us to view these reported paranormal anomalous experiences in the context of the experienced life. Are the experienced able to cope effectively with their everyday life while having this experience, or are these experiences disruptive to their reality rhythms? Are they having problems that are directly related to coping with this unusual experience, or are these paranormal anomalous experiences in fact manifestation of other ongoing psychological problems? Rather than overemphasizing the unusual experience themselves, or immediately trying to determine their authenticity, it's important for us to focus upon helping clients achieve a balanced relationship between internal realities and the existence demands of social living. And further remarks, as the most parapsychology are aware, anomalous psi experiences did not begin in the laboratory. They occurred in real life. They were experienced in ways that people related to one another in their impact to help one another, and their search to understand things that seemed beyond their own powers of comprehension. With the advent of the scientific method, scientists withdrew to laboratories to study particular chunks of the world. As they matured and felt that they had some facts, members from the cloister began occasionally to re-emerge in the sunlight of daily living and tell people what they had discovered. They providence notions that helped elucidate other fields of inquiry, and they were able to offer suggestions on how to help people in their daily lives. It is a sign of security and maturity then for science to feel that it has something pragmatic to offer. What is the place of parapsychology? It is the time for experimental parapsychology to come out more openly from its laboratories. Do we have anything to offer? Should we wait any longer? Parapsychology was a fragile child belonging in the lab, and it was dangerous to carry it outside those doors. Thus, there seems to be a moderate but continuous demand for help, and it is within our responsibility as parapsychology trying to normalize the paranormal to provide a public service in this matter. In such case, most parapsychologists suggest that the contactee seek professional help. Unfortunately, therapists knowledgeable about the spontaneous psi are few and far between, and it is often impossible to refer the contactee to a specific therapist living in his or her area. Referrals are also made difficult by the problem of assessing a therapist's parapsychological expertise if he or she is not well known in the field. Thought expertise for the purpose would be obtained by completion of one of the intensive course now being offered by a number of parapsychological research laboratories in the United States, Latin America, and Europe, or of a special workshop of psi counseling by qualified therapists. At present, counseling at research laboratories tend to be on an informal basis. This approach is effective for certain categories of questions, for example, expert opinion regarding the paranormality of a particular experiences, and requests for the testing of certification of psi ability, advice on psi development, and when the contactee appears psychologically stable. However, in reviewing a log of our calls, or phone calls, for a 3-month period, I found that for at least half the callers asking about psych experiences, these calls and contacts like them constitute a great source of difficulty for the research parapsychology who, and trained in psychotherapy, cannot be sure whether the disturbance is the cause or the consequence of the reported psych experiences, or indeed where they are related at all. Much time and energy is spent in frustrating encounters that do little to help the person solve long-standing problems. Thank you very much.